Hi, I'm Dr. Preston Parry, and this video is on how you test the uterus for fertility. Now, there are a lot of tests that have been done over the years, and HSG used to be one which is an X-ray dye study of the pelvis, used to be done for a long time. However, that 2D black and white image, most doctors would say is a test of the past and not great for the uterus. It can provide some information for the tubes, but we've mostly moved away from it for the uterus. The more common approach is to use an ultrasound. Now, ultrasound's much better for the outer uterus sometimes than the lining of the uterus, but it can tell you fibroids, it can tell you glandular changes, and there are valuable things to be found from it. 3D ultrasound, which some OBGYNs do well and others less so, can even find more detail and resolution about the anatomy. But the sort of evolving gold standard for the inner uterus is hysteroscopy. Again, taking a fiber optic camera, the dimension of a coffee straw, small enough to go in the male bladder without anesthesia. That can often be done gently. However, you have to ask your OBGYN what size hysteroscope they're going to use. If you've never had a vaginal delivery, your cervix is often 2.8 millimeters in width, and some are more, some are less. But if you've had a vaginal delivery, it's more in the 4.2 or sometimes more. And so if they're using a 5 millimeter camera on a 2.8 millimeter space, that can be really, really crampy. And so you want someone who's using a small camera for your anatomy if you have not had a vaginal delivery before. But that can actually look inside the uterus and find infections and polyps and scarring. Ultrasound can pick up a lot of polyps. Saline infusion sonography, where you actually infuse fluid into the uterus to sort of open it up, can find even more. But again, hysteroscopy can often see things in the corners of the uterus and on the millimeter size that regular ultrasound and sometimes even saline infusion sonography can't find. A final approach that people often will use for imaging the uterus is MRI, or magnetic resonance imaging. That seems to have value for adenomyosis. Also, for when people have a lot of fibroids, the sonography or ultrasound can have signal scattering where you don't see as much. So you have to customize it or adjust it to your own particular circumstances. However, most people believe ultrasound's very good, or most of the time works for the outer uterus. Hysteroscopy is the gold standard for the inner uterus, and MRI is also gold standard, but often can add cost in a lot of circumstances and may not be the first line in many situations. Final way of looking at the uterus that some people will draw upon is laparoscopy. But again, if that's a $10,000 surgery with incisions, anesthesia, and some recovery, usually you try to find as much information as you can from other methods before you jump to having a surgical approach where you're under anesthesia and asleep for it. I am happy to answer all these questions in greater detail personally as well as here. Send your questions and follow us and like us, and please let us know what we can do to clarify fertility and pelvic testing for you. Thank you.